The vitamin D and omega-3 trial is a large-scale randomized clinical trial testing the role of vitamin D supplements, 2,000 IUs a day, and the marine omega-3 fatty acids, 1 gram a day, in the primary prevention of cardiovascular disease and cancer. This is a large-scale trial in nearly 26,000 U.S. men and women, midlife and older, and has racial ethnic diversity. And what's unique is that it is a primary prevention trial. The participants are at usual risk of cardiovascular disease and cancer. They have no prior history of either of these diseases. Previous randomized trials of the omega-3s have generally been in high-risk populations with prevalent CVD or selected risk factors for CVD. So this is a more representative study population. And previous randomized trials of vitamin D have tended to be smaller or to have tested lower doses or bolus dosing as opposed to daily dosing. So overall, what we found, starting with the marine omega-3s, is that we found that overall, for our primary endpoint of major cardiovascular events, a composite of myocardial infarction, stroke, and cardiovascular mortality, that there was a non-significant 8% reduction in risk. However, for a pre-specified secondary endpoint of total myocardial infarction, fatal and non-fatal, we found a significant 28% reduction. We found no reduction in stroke or cardiovascular mortality when examined separately. When we looked at how the results might vary according to the baseline fish consumption, fish is the major source of marine omega-3s, we found that those who had intake below average, which was 1.5 servings of fish per week, had a significant 19% reduction in the primary endpoint of major cardiovascular events and a 40% reduction in heart attack. But there's no reduction in those who had higher fish intake. Now, these are subgroup analyses and should still be interpreted cautiously, but we did find some evidence that the baseline diet and nutrient status made a difference. For the omega-3s and race ethnicity, we did find a greater reduction in heart attack among African Americans. Again, we think this needs to be replicated before it's ready for prime time. For cancer endpoints, we found no association between omega-3s and cancer death. With the vitamin D component of the trial, we found no significant reduction in any of the cardiovascular endpoints. And this was the case even when we looked at those with low baseline blood levels of vitamin D. Looking at the 25-hydroxy vitamin D, even if it was quite low, there did not appear to be a reduction with supplementation in the risk of cardiovascular events. However, we did see a signal there for a reduction in cancer death. We saw no significant reduction in the incidence of cancer, but cancer death was 17% reduced in the overall follow-up period. If we accounted for latency period, after excluding 2 years, we found a significant 25% reduction in cancer death. Now, this has been suggested by previous studies that vitamin D may affect tumor biology and make tumors less invasive, less likely to metastasize. So there may be some biological plausibility to an effect on cancer death, but not cancer incidence. And it's consistent with previous randomized trials when looked at in a meta-analysis and previous clinical and animal research. So overall, in terms of implications, we think that the findings suggest if patients are already taking vitamin D or omega-3s over the counter, our trial would not provide a strong reason for them to stop. We did not see adverse events. We did not see side effects, hypercalcemia, bleeding with these doses, but we would encourage clinicians to warn against the mega dosing because very high doses may lead to hypercalcemia with vitamin D or to bleeding and other risks. For those who are not taking these supplements, we don't think that there should be any broad recommendation to start taking the supplements. However, for those who have low fish intake, even though we should make the recommendation to get the omega-3s from the diet, with low fish intake, there may be some patients on an individual basis who may be considered good candidates, especially if they have multiple risk factors for cardiovascular disease and have low fish intake. I think we need to replicate the findings in African Americans, and hopefully over the next few years there will be additional data from not only vital, other endpoints that are being looked at, diabetes, cognitive function, but also other trials that will help to inform whether clinical guidelines should change. Thank you so much for your attention.